To schedule an appointment and get it done, CTV's Alexandra Pinto met with Dr. Ali Hussen to talk about eye care for kids.
Well, kids go back to school in less than 2 weeks, and right now is probably crunch time for you getting all their school supplies ready. But what about getting an eye exam for your kids? Not something too common. Dr. Hussen joins me now with Conestoga Eye Care. Why is this something parents should do before children go back to school?
So as you're aware, parents know their child inside and out. They know what their favorite color is, what their favorite food is, what their favorite animal is, but they don't know how well their child can see. But seeing an optometrist will help that situation resolve that issue and find out how well they can actually see. As you know, vision and eyes could be overlooked, and kids don't know the difference between seeing blurry and seeing clearly, and cannot be clearly depicted unless you get an eye examination and they would see a difference. And as you're aware, vision signs are not as obvious and not as clear until it becomes really severe. So early stages, it can be overlooked.
So this is the perfect time to get an eye exam.
Absolutely. Back to school could be part of the bucket list on top of back to school shopping. As you're aware, 80% of learning is done through vision. So if a child cannot see clearly, will not perform well in school. So for example, if they have difficulty seeing the board, difficulty reading, difficulty with their eyes going out of focus, they'll be copying stuff wrong, which will lead to poor academics in school.
So what are some signs that someone's child may need glasses?
So for example, there are a few signs. First of all, for distance, for example, would require, you would see the child squinting their eyes, sitting close to the television, tilting their head, covering one eye over the other, would all be signs for a distance-related issue. However, it could be alternately need glasses for reading as well. If they have trouble focusing for up-close activity, trouble skipping words, whatnot there, this is called accommodative insufficiency. Even though they would be seeing 20/20, their vision for up-close would be over-focusing. And a pair of reading glasses would solve that issue and be able to read properly and sufficiently.
What about when it comes to children and contacts? Is it safe for children to be wearing contacts?
Absolutely. In our office, the way we consider contact lenses for children is above the age of 9 and depending on the maturity level. If they're mature enough and they're able to handle contact lenses, yes, so be it. Then we'll prescribe that for them and educate the patients for so. Now the contact lenses we go to for children are daily disposable contact lenses. That's very safe, clean, healthy, and hygienic for the patient. With regard to that, it's very convenient. You put the lens on in the morning, and in the evening you remove the lens and take them off. So less hassle for the child, no maintenance whatsoever, and very easy to handle. That would boost the child's morale, their sports performance, and overall their self-esteem.
And finally, when it comes to getting an eye exam before going back to school, I'm sure one question a lot of parents want to know is, what's the cost of this?
So the cost, to be honest with you, it's free. So OMIB covers a child eye examination every year. So it's definitely advantageous for the parents to take advantage of the situation. With regards to that, even if they're not complaining or they are complaining, it's good to come in just to rule it out and just to be on the safe side and make it part of the bucket list. So every year in August or September, right before school starts, the start of the new grade level, come in and get it checked. And that's probably the best advice I could give any parent.
Perfect. Dr. Hussen, thank you so much.
It was a pleasure.
And I will send it back to you.
All right, a new